Hello everyone, this is Izu. Today I'm with Dr. Rhoda Suubi to talk about fibroids. Hello Dr. Rhoda, thank you for making out time and agreeing to speak on this important subject that affects many people around the world. Before we continue, could you please tell us a little bit about yourself, where you are from, your profession, and qualifications?
Hello everyone. Thank you, Izzy, for having me and for inviting me for this forum to speak on this important topic to everybody. As they've introduced me, my name is Dr. Rhoda Suubi. I come from Uganda. Uganda is in East Africa. I'm a nurse educator for the last 17 years. And I've worked in different countries, like my own country, Uganda. I've worked in Kenya, I've worked in Tanzania, I've worked in Canada, and I'm currently working as a nurse educator in Oman, where I'm still teaching nurses. And I've taught nurses in various settings, in the clinical settings and in the community. I have a bachelor's degree in nursing, I have a master's degree in nursing, and then I have another master's degree in reproductive health, and I have a PhD in nursing. So that is basically who I am. Thank you, Izu.
All right, thank you. What an impressive resume you have. Doctor, what are fibroids?
Thank you, Izu. Fibroids are sometimes what we call uterine myomas, or some people call them leiomyomas, of fibromas. Okay, so when I talk about fibroids, the fibroids are a firm or a solid tumor that are made of smooth muscle cells and connective tissue that develop in the uterus. Okay, so in 99% of the fibroids are benign, and what that simply means that they are non-cancerous.
Okay.
So the 1% could turn into cancer.
Okay. So are they infectious? Like, can they be transmitted from one person to another?
They are not infectious, but they can be genetically transferred, as in familial. Like if your mother had fibroids,
Okay.
you could get fibroids, but not infectious. Like if I touch a person with fibroids, or if I use the same utensils with them, then I get fibroids. No.
So what causes fibroids?
Okay. It's very unclear what causes fibroids, but the cause has been attributed to several factors. Okay. The first factor is the hormones. Okay. Because fibroids only affect female, and we have the female hormones, which are usually estrogen and progesterone.
Okay.
These hormones are responsible for giving us the female features. Okay. And they are produced by our ovaries, and they cause the lining of the menstrual cycle. So they stimulate the growth of fibroids, number one. So, and then the family history, just like we talked about, if your mother or sister or grandmother had a history of the same condition, you would get fibroids. And then pregnancy as well increases the production of estrogen and progesterone. So the pregnancy state can also stimulate formation of fibroids.
All right. So can some medication cause fibroids? Like, for example, there is a rumor, an assumption that taking contraceptives can lead to having fibroids.
Yes. It has been stated that some people who are taking oral contraceptives as being high risk for having fibroids, because the contraceptive contain the same hormones that we're talking about. They are a combination of estrogen and progesterone. So anything that increases estrogen or progesterone in your body can expose you to fibroids.
All right. So what are the symptoms of these fibroids? How can someone know they have a fibroid?
Okay, the number one major symptoms is heavy or prolonged menstrual periods. Or then there's abnormal bleeding between the menstrual periods, like between the cycle, and then pelvic pain, okay, due to the tumors pressing on the pelvic organs, Some people will have frequent urination. When the fibroids grow bigger, they'll be compressing onto the bladder, so you have frequent urination. Then they also cause lower back pain or pelvic pain.
Okay.
And then there's also pain during intercourse due to the fibroids. And then sometimes people feel pressure, or they call it fullness in the lower abdomen. Okay. And then there's swelling or enlargement of the abdomen. So those are the most common symptoms for fibroids. But when I mention them, it doesn't mean that a person presents with all those symptoms. Okay. Usually, the one symptom that will cause the patients to go to hospital would be the heavy menstrual flows.
Okay.
Because usually they cause them lots of anemia.
All right. So who is mostly affected by this condition? Okay. And what are the risk factors?
Okay. So mostly affected comes together with the risk. Who is at risk?
Okay.
So women, we are all at risk for developing the fibroids.
Okay.
But usually, because I talked about the hormones, pregnant women,
okay,
familiar history of fibroids, anyone aged 30 or older,
okay,
being African or African American.
Okay.
Okay. And then obesity,
okay,
alcohol consumption, poor diet, and then people who are taking oral contraceptive pills.
So what makes African or African Americans more predisposed to fibroids?
Okay, a research was done at the National Institutes of Health in the US, and they found that African women, because they could be African women, they could be African American, as long as we have a genetic makeup of African women, we have 5 times higher odds, okay, of having severe symptoms or developing fibroids. Okay, and we develop them maybe 5 to 6 years earlier than other women from other races. Okay. Okay. So that is just our genetic makeup, I think, that exposes us to that.
So that means it's more common so it should be common among Africans?
Yes, it's more common among Africans.
Okay. How can one diagnose this condition?
Okay. For diagnosis, the woman has to visit a gynecologist. Okay. And what the gynecologist does, they do a pelvic exam. Okay. The pelvic, because the uterus is in the pelvis. So they do a pelvic exam, and then during the pelvic examination, they are checking for the condition, the size, and the shape of the uterus. Okay. And then they may do additional tests like ultrasound or pelvic MRI, which is a deeper imaging test to see where the fibroids are, how big they are, which part has been invaded, which parts have been compressed. Yes, that's basically how they diagnose fibroids.
Is there any treatment for this condition?
Yes. Usually, because you've gone to a gynecologist, after they've diagnosed you, they'll put you on treatment. Okay. And then the treatment plan is usually based on your age, the size of the fibroids, and your overall health. Okay. So they may give you a combination of treatment plans. Okay. So, but just to talk about the specific treatment plans, they may give you medication. Okay. Okay. And usually this medication is to regulate the hormone levels so that they can shrink the fibroids. Okay. So anything that cuts off the supply for the fibroid to grow will shrink it. Okay. Okay. And then sometimes when the fibroids are so big, they take you for surgery to remove the very large one, and multiple growths that have been performed. That's what people call a myomectomy. Okay. And then we have other options, which may not necessarily be for shrinking the fibroid, but helping to reduce the symptoms that come with the fibroid. They may insert what we call an IUD, which is an intrauterine device to release hormones like progestin. Progestin reduces the production of estrogen and progesterone, so shrinking the fibroid. Okay. Or they can give you medication for pain or birth control pills. And then other people are using home remedies and natural treatments, and they've shown positive effects like acupuncture, okay, yoga, massage, or traditional Chinese medicine formulas. Okay. And then other people have resorted to diet. Okay. So avoiding meat and high calorie foods, and then eating more of the vegetables, green vegetables, taking more of green tea, cold water fish that such as tuna and salmon. And then finally managing your stress levels, okay, and losing weight. So most of the treatment is done in combination.
Okay, so there have been some cases where some women die, of fibroids. So what leads to such condition where people die?
I think they don't die because of fibroids. They die because of the symptoms that they get because of fibroids.
Okay.
For example, if someone bleeds a lot,
Okay.
and they are always anemic.
Okay.
When someone is anemic, they usually have very low immunity.
Okay.
So any disease that attacks their body gets them quickly. Okay. So you may find that they die for secondary reasons, but not because of the fibroids.
Okay.
Yes.
So I know some people die in when the surgery is being performed on them as well.
Mm-hmm.
So because of the bleeding as well.
It is the bleeding. So most times they store lots of blood when they're removing the fibroids, because patients tend to bleed a lot. So they will have packs of blood ready. Okay. Or most times they will want to give the patient time to accumulate enough blood before they really take them for surgery, because they know one of the problems will be severe bleeding.
Can a woman that have had fibroids be able to conceive?
Yes, they are able to conceive. Okay. Especially if the fibroids didn't occupy the inner layers of the uterus, which means the baby has space to implant in the uterus. They're able to conceive.
So if the fibroids is bigger than the uterus, it can prevent with the woman from conceiving.
It can prevent the woman from conceiving, or if the woman conceives, the baby will be competing for space with the fibroids and causing abortions for the women. Unfortunately, fibroids are not preventable, because we can't prevent ourselves from being Africans. We can't prevent ourselves from not getting pregnant. Okay. Sometimes we need all these oral contraceptives to control pregnancy. Okay. Fibroids are not preventable, but they are quickly and easily treatable.
So what's your advice for the women out there?
I think for the women out there, know your status. Okay. Know whether you're at risk. Okay. And then seek for what we call screening early. If you have any of the symptoms that we have mentioned, then it is easy for you to go and seek for medical advice, just to rule out that you have the fibroids or not. Especially before you get pregnant or you're planning to have a baby. Yes, because then you don't want your pregnancy to be interfered with fibroids. So
this treatment you mentioned earlier, is it permanent treatment, or can fibroid reoccur even after treatment?
Unfortunately, fibroids reoccur. Okay. But usually if women have children consecutively, they rarely occur again. They usually occur more in nulparous women who don't have children, like the nuns, or people who have never had children, who due to many other issues, or the young girls and all that. But they reoccur sometimes, or they may not reoccur.
So can it occur in a woman who is like maybe 80 years old, 70 years old, or?
I haven't seen fibroids in 80 and 70-year-olds. Okay. It's usually around between 30, 40, 50 years old.
All right. Thank you so much, Dr. Rhoda Suubi, for taking our time to advise us and talk to us. And we hope that the women out there will take your advice serious and seek medical care, see their gynecologist, and to see if they are at risk of fibroid. Thank you so much.
Thank you, Izzy, for having me. It was a pleasure being part of the forum. Thank you.